Friends, this is knee joint of 17-year-old football player who has twisted his knee. You can see that posterior root of medial meniscus is torn and detached. Also, anterior horn of medial meniscus. You can see that medial meniscus is completely extruded from the joint. We are seeing that meniscus is like a floppy structure. There is no attachment either in the posteriorly or anteriorly. We are feeling the bone directly on the medial side. Like this type of bone is not visible when meniscus is present intact. This is a lateral meniscus. You can see the detachment of the posterior root of the lateral meniscus. Along with there is some tear in the posterior horn. This is the delamination from the meniscus medial end to the up to the posterior 2/3, posterior 1/3 of the posterior horn. We are trimming the part which is now free ends which are not able to be stitched, and remaining part of the meniscus now we are taking the bites through the scorpion. This is a specific kind of threads used for the root repair, that is a T-button and the loop in the loop. This is very useful because once we attach the button on the tibia, we can use sliding knot so that button is snugly fit on the mouth of the tunnel. You can see there are two loops if you have not missed it. There is again two different color sutures. Bites are taken from the posterior medial side, that is the medial meniscus. Posterior horn is a white colored and the black colored tiger wire and the black colored wire. There is a loop in the loop. If you have not missed, if you see it carefully, this is a loop. So since there is a loop which is attached to the meniscus and another loop, we can do the sliding knot. This is a jig. You can see that we are using the jig medially. In this case, because we have to create three tunnels, medial meniscus posterior jig is kept medially, lateral meniscus jig is kept laterally, and the ACL jig is kept in the anteromedial. There is overdrilling of the guide wire and suture shuttling. Suture is suture is taken from the tunnel, and both the wires which we took bites in the root will be shuttled intraosseously and made to sit. You can see that nicely it is seated. Similarly, this is a jig for the lateral side. As I was telling, we have to create very carefully tunnels when we are doing multiple tunnels. You can see that very nicely posterior lateral tunnel is created, and the loop in the loop, you can see that now very clearly is passed inside this tunnel, so that the lateral meniscus is also seated nicely. This type of vision is not very clearly seen once we pass the ACL graft. You can see that now. But final tightening of both the meniscus is done only after ACL. This is the ACL tunnel, very nicely done, posterior and inferior part. This is all inside type of ACL. About 9 mm of the graft. You can see both the loops are taken simultaneously so that we are not creating any soft tissues. This is the femoral side button, flipping of the button with the marking of the loop. Then we will be starting to milk the graft in the femoral side. You can see that the graft is now going into the femoral side. Then we will be taking it from the tibial side. We have made the length of the graft as about 6.5 mm, 5 centimeters. The thickness of the graft is 9 mm. I was telling it before. You can see that now we will be passing the button from the tibial side, exchanging of the tibial loop with the loop which we had put suture shuttle. The graft is very nicely seated in the tibial side now. We'll be tightening it at 30 degrees of flexion, and then we'll be tightening both the ends of the buttons. After we do this, we will tighten both the roots of the medial and lateral meniscus, and then now this is another step for the fixing of the medial meniscus, which is extruded. The all suture anchor of double loaded, we are going to put it anteromedially with a sheath that is for the anchor. Then we will be using the suture lasso. You can see the meniscus is completely extruded. Suture lasso will be used to take these two threads from the meniscus substance at the meniscocapsular junction. Then both the threads are shuttled and then tightened together. Once we tighten both the threads, then the meniscus is made to sit in the area where it is supposed to be. Then the meniscus extrusion is obliterated. You can see meniscus is inside the joint now very nicely. Very nicely, root is seen, meniscus is seen. We have reattached the anterior horn of medial meniscus, posterior horn, posterior root of medial meniscus, posterior root of lateral meniscus, and ACL reconstruction all together in one surgery. Thank you for watching this video. If you have liked it, please like it and don't forget to subscribe to my channel.